Slide 16. Derivatives and anomalies of the first arch, cleft and pouch. Item 1. The first or mandibular arch divides into two parts: the maxillary process and mandibular process. The cartilage of the maxillary process disappears, while the mandibular process persists as Meckel's cartilage. The mesoderm of the first arch gives rise to the muscles of mastication, the anterior belly of the digastric muscle, and the tensor tympani. The mandibular process, malleus, incus, and sphenomandibular ligament, the dentine and cementum, the tragus and cross of the helix, and the first aortic arch derivative, the facial artery. Item 2. Maldevelopment of the first brachial arch derivatives result in various congenital malformations of the eyes, ears, palate, and mandible, which constitutes the first arch syndrome. This constellation of symptoms is a result of insufficient migration of cranial neural crest cells into the first brachial arch during the fourth developmental week. The two main manifestations of the first arch syndrome are recognized as Trenchard-Collins syndrome and Pear-Robin sequence. Other anomalies consistent with these derivatives include agnatia, micrognathia, and macrognathia, associated with abnormal development of the mandibular process. Anotia, macrotia, and cynotia are also related to the faulty development of the ear. Item 3. The ectoderm of the first brachial cleft develops into the epidermis of the cheeks, mandible and rostral half of the auricle, cranial nerve 5, salivary gland parenchyma of the parotid, submandibular and sublingual glands, enamel of the teeth, the epithelial lining of the lips and tongue to the foramen secum, and the epidermis of the external auditory canal and tympanic membrane. Item 4. The most common abnormalities to the first brachial cleft is associated with the external auditory canal. This can generally be classified as aplasia, atresia, stenosis, and duplication. The common diagnosis of recurrent purulent draining otitis media with lymphadenopathy should alert the clinician to investigate a possible first brachial cleft duplication anomaly, classified by work as type A or type 2 anomalies. Item 5. Endoderm of the first brachial pouch gives rise to the covering of the first arch and pouch, which passes as the eustachian tube, tympanic cavity, mastoid atrium, and cells, and the epithelial lining of the sides and floor of the mouth. Anomalous development thus produces atretic eustachian tubes, common in children with recurrent otitis media. Diverticular of eustachian tubes, absence of tympanic cavity or mastoid antrum and cells, double or perforated tympanic membrane, bifid and trifid tongue, and bronchogenic nasopharyngeal cyst.